endometriosis is and how it affects a woman's reproductive system?
So endometriosis is actually when some of the ovarian tissue gets dislodged and gets onto different parts of the pelvis. So these are the hip bones up here. This is the pubic bone down here. So here's the uterus, this would be the bladder, this would be the intestine. So you can see you can have endometriosis on the intestine, you can have little dots of endometriosis on the uterus, on the tubes, or on the bladder.
Okay.
Then there's part of the covering of the inside of the pelvis, which is called the peritoneum. You can also have endometriosis on the peritoneum.
But what causes endometriosis?
Nobody really knows.
No.
It's a genetic problem or a congenital problem, and some women have it, and we're just not quite sure what causes it. Endometriosis can also affect the ovaries, and you can get a big cluster of endometriosis within the ovaries, and what that will do is get what's called a chocolate cyst, and it's a cyst filled with blood.
Wow. Now, are there symptoms? Do women experience symptoms? I mean, I often heard pain as being one of them.
So one of the most common symptoms is pain. And that can be pain with your menstrual cycle, it can be pain with intercourse, it can be pain when you urinate, or pain when you have a bowel movement.
Okay. And does it affect a woman's ability to have a baby?
Absolutely. So if very often it will cause damage to the tubes. If it causes damage to the tubes, that's one problem. There's also lots of women who have endometriosis who have a completely normal pelvis with the exception of the endometriosis, and so we think there's an unknown inhibitor which causes infertility.
Now, with endometriosis and having it affect pregnancy, are women who have this condition often advised to maybe freeze their eggs, or?
No, actually not. We choose to treat the endometriosis itself. So there are surgical procedures where we go in through the belly button, and then we can burn off the endometriosis. We can also assess the quality of the tubes, the quality of the ovaries, see if there's any scar tissue created from the endometriosis. If we see scar tissue, we can break down that scar tissue. Then there's a whole series of medications we can give you to try and treat the endometriosis. And when you finish completing the surgery and the medication, the chances of fertility are excellent.